Hi, my name is Selena Faidallah. I am a third-year resident at Wayne State University, Detroit Medical Center Internal Medicine Program. And today I'll be presenting a unique case of lupus flare-up causing TTP-like syndrome. As we all know, lupus have a wide range of hematological complications like anemia and thrombocytopenia. However, microangiopathic hemolytic anemia is rarely reported in the literature. And we also know that microangiopathic hemolytic anemia is a well-known manifestation of TTP. And today we're reporting a case of a middle-aged female who has a known history of lupus and presented with a lupus flare that mimicked TTP-like syndrome. We have a 49-year-old female with past medical history of lupus, medication non-adherence, previous episode of lupus encephalitis, who presented with altered mentation. Her family noticed that the patient has not been herself for a few days, and they brought her to the hospital because of that. Initial examination showed the patient was confused and disoriented. She also had oral ulcers, diffuse severe discoid rash, and her initial laboratory workup showed increased creatinine from baseline, proteinuria, thrombocytopenia, and anemia. There was initially a high suspicion of TTP given the altered mentation, AKI, thrombocytopenia, and anemia. Patient peripheral blood smear also showed schistocytosis, spherocytosis, and nucleated red blood cells, and here we are showing a similar peripheral blood smear to the one that our patient had at the time of the admission. With a high suspicion for a TTP in mind, the patient was started on plasmapheresis and a high dose of methylprednisolone. At the same time, patient was also evaluated by both rheumatology and hematology, and further workup was done that showed positive ANA, low C3, C4, and elevated LDH and haptoglobin. However, her ADAM-TS13 came back normal, so it was deemed that this was a lupus flare-up rather than a TTP. So plasmapheresis were stopped and patient was continued on methylprednisolone and her home dose of CellCept with dramatic improvement in her symptoms. To conclude this case, lupus flare can mimic many other non-medical syndromes, and such cases might represent a diagnostic challenge for physicians, as prompt recognition of such potentially fatal complications and adequate management could be life-saving. Thank you.